Well, welcome you guys. I'm going to be talking about a really exciting new therapy, photodynamic therapy, and it's actually something that really doesn't exist much here in the United States. You can go down south to Mexico and Germany, you can find it there. But here in the United States, we really don't have very many people that do that at all. There's a lot of research that's been done on it. It's something that you use for skin cancer with great success. It's actually one of the standard of care for skin cancer. And I'll go in a little bit more into what photodynamic therapy really means. There's been some issues in regards to its ability to deal with cancer that are deeper, and I'll go through how that has been overcome. But it's a really new, exciting therapy, both for cancer, for infectious agents. It's really amazing. So this is what it looks like. This is just the machine we have here at the office. It's called a Weber device, and when you do it intravenously, you actually have this optic cable that is then inserted intravenously, and as the blood passes by, it gets treated by that laser light. So it's just not a normal, it's just regular light. It's actually a laser light, and you can use different colors, like here you see green, red, and they all have different effects on the body. And laser light, I mean, it's just light amplification of stimulated emission of radiation. So it's a monochromatic light, which makes it so much more powerful than just regular light. So you can see here, laser light, it's a precise color, monochromacy, and it's characterized by an arranged photo stream, so they're all coherent, which gives them that much more power, that much more punch in their effect. In regards to then a general light bulb that we have up here, you see light is going a little bit all over the place. And you can actually see if you're using a true laser and you have it kind of shine it on an uneven surface, you see that kind of speckle effect, and then you know that it's a true laser. And that's what we use in our Weber device. It is a true laser. There are other machines out there that uses not true laser, and obviously won't have the same full effect. Still have some benefits, but not to the same extent. So laser, we have it in dermatology, dentistry, something we've used a lot, ophthalmology. But here, we're using it then for, it's called photodynamic therapy. People are using it for cancer. So here you have an individual actually using then a light. So this is external laser light, where it's just impacting then the body that way, so you can absorb it then through the skin. There's a little bit issues as to how deep the light goes into the skin. But here you can then shine it directly on areas, like if you have tongue cancer or tumors in other areas, using then light to kind of go after it. Again, this is what the machine looks like. And here you have all these different optic fibers, optic cables, that can then deliver anything from then ultraviolet to infrared. And you can use this externally for like acupuncture points, and also you can use it then around the tumor. So if you have something external, you can then put infrared or red light, and that penetrates a little deeper and then get into the tumor. Or can then, if you work on tissue, if you joint regeneration, tissue regeneration, it's been used a lot for that. And so you can see the difference between just using a regular little laser versus them being able to place them on the locations, all the different areas. And this one is much more powerful, much stronger, and this kind of true laser. So here you see these kind of optic fibers, what they look like, and let's see if the different colors. And here you again just see kind of topical uses, for trigger points like hip pain or back pain, for joint arthritis, treating the joints. Here you have bronchial asthma, where you treat on different points and with this light. But then, as I said, we can do it then intravenously, and we can do it interstitially and intra-articular. So intra-articular just means that, let's say you have a knee issue, you want to restore function in the knee, you have inflammation or degeneration. You can then use, you can put the needle, a fiber optic needle, then into that joint space, ultrasound guided, and then stimulate the regeneration of that tissue. And it's quite amazing. We used it a lot here. We had a gal, a young girl that after the chemotherapy that she went through, all her joints just started to degenerate. And so the orthopedic surgeon had replaced, I believe, one hip and was looking at replacing the other hip. But her shoulders were also, starting to degenerate, and the surgeon just felt so bad for the patient that wanted to do everything that he could to not have to replace all 4 joints. So she came to us, and we used an intra-articular laser light and stimulated those areas, and they're growing back. I mean, it's starting to heal and regenerate, and following up that later with stem cell therapy to even get that extra punch. So yeah, it's really exciting to see. Or for interstitial, let's say you have a tumor in a certain area, or you have an area that needs regeneration. You can then bring the needle, then ultrasound guided to that location, and just kind of shine the light on it, because one of the issues is that the skin is like a barrier, so it will absorb a lot of the light. So the light will only penetrate so deep, and to be able to get through that skin barrier will help a lot. And that was some of the challenges that we're dealing in the past with photodynamic therapy, was to get the laser light strong enough delivery to where the tumor site is at. So there are certain things that we've done then to overcome that, and one is then to be able to penetrate the skin barrier and get that optic fiber closer to the tumor, so you can shine it there. So intravenous blood irradiation, just seeing the different colors, and ultraviolet, green, blue, red, so just kind of seeing what it looks like. And every time then the blood passes through, and it passes through every few minutes, which means that in an hour's treatment, you'll probably treated your blood 15 to 20 times, your whole blood volume, which makes it so nice, because there are other therapies where you then take out the blood, treat that, and then put it back in. The limitations are obviously you're just treating the blood that you're taking out, in addition to you're taking it out of a sterile environment, and you're still kind of having it in the bag, but it's still not as sterile as obviously you just keep it in the blood, in the bloodstream, and just treating it directly. So here you see someone dealing with a tumor in the neck, and just bringing that light directly to the site. Breast, same. So here is what I was talking about, the penetration of light. As you see, the ultraviolet, blue, those are very low. It's not even a centimeter, and the green one, actually the green is 5 millimeters, so that's like half a centimeter. And then red will penetrate then to about 3 centimeters, which is about an inch. And infrared is the deepest, about 6 which is a little bit more than 2 inches, so like 2.5 inches. So that becomes the challenge, and that's why using it interstitially becomes so important. And the interstitial therapies, I think, were probably, I actually don't know of anyone here in the United States that does it other than us. So, so as you can see, intravenous light therapy has been around for a while. It's back in 1903, where we used an ultraviolet light. And it started back in the 20s, and they used that actually to get rid of like pneumonia, tuberculosis, and even cancer at that time, and also to combat the polio virus. But then when the antibiotic came out, that was a bigger moneymaker for the medical industry. So then UVBI, ultraviolet blood irradiation, it just kind of fell into the background. They use now ultraviolet light then to kind of sterilize surgical instruments to eliminate MRSA. So if it can eliminate MRSA on a tool like that, then imagine what it can do in the blood. So light is really, really powerful. The method then of this intravenous laser blood irradiation. You have a Soviet scientist back in 1981. He was starting to use it for cardiovascular disease. And seeing fantastic impact and using UVBI for that. And then also for different, to support the immune system. It's just been around and it's really been used in several different ways. So the biological mechanism then of this light is that there are certain cellular structure within the mitochondria that actually has photoreceptors. And that light then changes the chemical behavior and the metabolic activity and the movement and gene expression. So it has all that impact within the cell. So it becomes an extremely, extremely powerful tool. And it impacts an enzyme production, protein production, and this kind of effect impacts the whole cell, has kind of ripple effect throughout the whole cell. And this is then from Dr. Hamblin, Michael Hamblin, which is the gentleman that I had the pleasure to interview then on my radio show. And he went into this in great length, the impact that it has on the cell on the radio show that I did. So you have then different lights impact different components then of the electron chain transport, which is part of the Krebs cycle, or part of where we produce energy within the mitochondria. So you have these 4 different complexes that is kind of moves the energy production along. Complex 1 is kind of like the first stop. Complex 2, second, third, fourth. So it's kind of these gates that light move through. Complex 1 then absorbs some blue and ultraviolet light, and that activates that component of the mitochondria. Complex green and yellow activates the complex 3, red and infrared complex 4. So just kind of seeing how it turns on then the mitochondria. And what's interesting with looking at cancer, it is looked upon as a mitochondrial disease, meaning that the mitochondria shuts down and the cells start to produce energy in a different way. So if we can activate the mitochondria, which light will do, then we can also turn on the cell death switch, which exists within the mitochondria. And another function that the mitochondria does is that it actually helps to heal damaged genetic material. So if the cell is kind of, the genetic material is somewhat damaged, but it can be repaired, then the mitochondria will help to heal that. But if it's too much, then the mitochondria will turn on the cell death switch and the cell will destroy itself. And that is one of the issues with cancer cells, is that they don't have that cell death switch, because the mitochondria is bypassed. So it generates energy out of the mitochondria. So by using light then to activate the mitochondria becomes a very powerful a powerful component of that therapy. So then you have the different lights, and each light have different effects. They can be utilized for different things. So the red light is very good then at reducing that aggregation when the blood gets very clumpy. And clumpy blood doesn't transport oxygen very well. And also it puts a lot of stress on the heart. So for people who are dealing with cardiovascular issues, it's not thinning the blood, but allowing the red blood cells to be able to transport oxygen and get to tissue quicker and better. So it does that. It activates and the killing activity of the macrophages, which is part of the immune cells. So just activate them so that they're more efficient in killing things, like bacteria, viruses, cancer cells, tumor cells, whatever it may be. Stimulates also the production of lymphocytes, B cells, and T cells. So increases the activity of the immune system that way. Also stimulate the immune response with immunoglobulins IgG, IgM, and IgA. And stimulation of interferons, interleukins, tumor necrosis factor alpha. And all of these are therapies that in themselves, like interferon therapy is a big deal in the past in regards to cancer. So to be able to stimulate it naturally becomes a really powerful tool. Interferon by itself, when you're using medically, had a lot of drawbacks, but then to be able to do it within the host becomes quite amazing. Also the oxygenation, so hypoxia of the tissue is improved, and also the breakdown of fibrinogen, which kind of clogs up the blood. It helps to kind of break that up. So just healthier blood, oxygenate, activates immune system, also has a sedative effect, pain-killing effect, and improves microcirculation for nervous system, hypothalamus, limbic system, and so it does a lot of cool things. Just the red laser. Then you have the green laser, and that one actually binds to the hemoglobin. So it binds to the hemoglobin, the red blood cells, and increases then that oxygenation. So it really speeds up the oxygenation, allows then the red blood cell to be much more efficient in holding on to oxygen and carrying oxygen. So anytime you're dealing with oxygen deficiency, then green light is fantastic for that. And also decreases lactic acid, and that's really interesting when you're dealing with cancer, because lactic acid becomes one of those chemicals that the cancer cell used to drive its own existence, to stimulate metastases, to also support and the recruitment of healthy cells around the cancer cell to make them cancerous. So the more we can control and reduce lactic acid, which a green laser does, the less stimulation for metastases we will have. And then improves blood flow, stabilize, it activates repair of tissue, activates and the platelets, again for the repair of the tissue, and also has a very important effect on the sodium-potassium pump, which is crucial for the health of the cell in itself. That sodium-potassium pump, it controls and the charge around what's called the cell wall membrane around the cell. And what they've seen is that a cancer cell, that charge actually get quite reduced. It's supposed to be like 0.81 millivolts or something like that. And when you're dealing with a cancer cell, then that gets quite reduced and it loses its charge, which one will lose the ability of that cell to function normally. So by supporting that pump, we can then keep that charge healthy. And so the green light becomes very helpful in that area. and seeing the mitochondrial alteration. So it has a huge impact then on the mitochondrial activity. And you see here, increases the energy production, just the green in itself, by 30% within the mitochondria. So an individual that is dealing with chronic fatigue or any condition where the energy is lower, can you imagine 30% more of what that is? So even for like athletic improvement in athletic activities, just this alone will help tremendously for performance and tissue repair. Yes?
Athletes get this treatment before Olympic Games?
Yeah, it would be fantastic, yeah. Doing this treatment before a sports activity, along with maybe like hyperbaric and some intravenous nutrients, I mean, that would be a powerful punch, before any kind of sports activity. So, so then we have the blue, which is quite amazing because of its impact in supporting the release of nitric oxide. And nitric oxide is actually like a signaling molecule that regulates growth, immune system, nervous system, and helps with analgesia. So pain control, is a vasodilator, allows the nutrients and blood flow get to places quicker. And something that's really fascinating is its impact in the telomerase. And telomerase is a kind of a within the genetic material, it's kind of like a countdown. As it's breaking down, you get closer and closer to death. So if you can slow down the breakdown of the telomerase, you're actually slowing down aging. And the blue laser then impact the nitric oxide that has that effect. In addition to everything else that it does, but its impact on the nitric oxide is huge, the benefits from that. In addition to that, because of that, it will then help to lower blood pressure. It's anti-inflammatory, and it will work on all these inflammatory substances, which will, all of those substances drive then cancer proliferation. So by calming all those inflammatory by impacting all those inflammatory substances, you will then reduce the cancer's ability to move forward. And also fantastic to treat infections. And it does that by creating then a reactive oxygen species within the infectious agents, being bacteria, virus, etc. So blue laser activates telomerase, anti-aging effect, so increasing nitric oxide bioavailability and endothelial nitrogen oxide synthase activity, activates telomerase and delays endothelial cells senescence. So it just reduces the breakdown of the telomerase. Again here, nitric oxide delays. So it just helps you live longer, anti-aging. So it's something that everyone should do if they want to live longer. Yellow light improves a lot of the antioxidant activity, and then also detoxification. So also known as the sun light, so it has antidepressive effect, and also then helps with pain, chronic pain, and also helps with both serotonin and vitamin D production. UV light also increased oxygen. So you can see all of these helps a lot with the oxygen. And oxygen, looking at cancer for instance, it has a very hard time to proliferate in an oxygen-rich environment. So if we can create an environment where it has a hard time to exist, then we can be very successful. Destroys fungal, viral, bacterial growth. Again, improves circulation, platelet aggregation, and dilates blood vessel, helps with detoxification, inactivate and remove toxins, and also activates cortisone-like molecules, sterols, and can turn them into vitamin D, and it helps also with fat metabolism. And so what it does in the antimicrobial effect of ultraviolet light is then also from the production of reactive oxygen species, and also it delays in the pathogen replication. So you can kind of see here before DNA, before UV treatment of a pathogen, and then you see how it destabilizes the genetic material within the pathogen to kill it off. So it's really amazing in that. So just kind of summary what laser light does. You can see you work on the ATP, immune system stimulation, microcirculation, activation of macrophages, the immune system, for heart metabolism, elasticity of the blood, of the red blood cells, so they can transport oxygen better, nitrogen oxide, anti-aging, blood pressure, inflammation, pathogen, killing off pathogens, detoxification, mood, pain, hormones, and also activation of stem cells. So using light, intravenous light, it can actually activate, make the stem cells 20 times more effective. So if for an individual getting that stem cell therapy and then using light, it becomes 20 times more effective. So we usually follow, like the gentleman that I was talking about with the shriveled up kidney, using then stem cell and then light, it enabled that kidney to regrow back to normal, which is pretty incredible. So photodynamic therapy, which is what I want to focus, which is kind of what we're leading up to. There are a few things that it involves, and the biggest thing is then using a photosensitizer, and you use light then to activate that photosensitizer, and that photosensitizer is in an excited state. You have tissue oxygen, and as this one goes down into its ground state, it creates an reactive oxygen species to then kill off the cell. So that's kind of the pathway of how a photosensitizer works. A combination with light, creating reactive oxygen species to create cellular toxicity. And since these photosensitizer has the specific photosensitizer that we use has an affinity to the tumor cells, they accumulate within the tumor cells and then have that toxic effect then within the tumor cells. So PDT, photodynamic therapy, it works then directly on the tumor cells to create apoptosis and necrosis, for tumor eradication, but also works on the inflammation to trigger non-specific immunity. That immune system will then work on the tumor, and then also it shuts down the microcirculation actually to the tumor. Which means that the tumor in itself starves and then dies from that. So I'm going to see a little bit how that works. So here we have photosensitizer administration, then it distributes throughout the body and accumulates in the tumor, and then use light therapy then to impact then the tumor. So you see here you have tumor cells, blood vessels, you do the PDT, photodynamic therapy. It creates a thrombus actually within the circulation to kind of start to starve the cancer, so it doesn't get the blood supply that it needs to function, and you start to have tumor cells. It's tumor cell death at the same time, and then also as a next step, the macrophages come in. And because it activates and the immune system responds, activates the macrophages, and the macrophages will start to kind of clean up then the dead cancer cells. So that's kind of how it works. So here's just some pictures again, kind of what. So this is kind of a external radiation of the laser. Here again, same gentleman, just kind of seeing what it looks like. It's a thyroid cancer. Again, that breast cancer. you have pancreatic cancer, have peritoneal carcinosis. So the photosensitizer that we, and this hasn't been around for a long time, as I mentioned. It's something that was it's using something that the indocyanine green, which exists in the body, but it's eliminated in 30 minutes. So what we needed to do is then to create a sensitizer that stays in the body, accumulates in the tumor. Because if it just stays in the body and for 30 minutes, we can't use it. We want something that accumulates over time, and so we can treat that area for many, many times. So created it, a lab then created in Germany, making a non-ionized, small particle, liposomal, which means that it's kind of a fatty membrane around, which allows it then to penetrate through cell wall membranes better. So that's what we're using as a photosensitizer, and it's specific for 810 nanometers, which means that it absorbs in the infrared. So we would use, with that sensitizer, we would use mostly infrared. This is what it looks like. Just very green. So you see it in the bag. It's just a green bag. And so again, 810, it absorbs the infrared light. The benefit is that the infrared light also has the highest penetration, through tissue. And then besides in the activation of the ICG to produce the reactive oxygen species, the single oxygen tumor tissue, it will also be warmed up. So you'll also have an overheating effect, which in itself will have a killing effect of that cell. So you have so in essence it becomes then a photothermodynamic therapy, because you're using both light and heat to kill the cell, and that's the benefit using then the photosensitizer along them with the light at the same time. So you get that effect. So the tumor then literally kind of melting away. This is what it looks like chemically. Here's where it peaks in wavelength, which is at 810. These are the properties of the non-ionized liposomal. It's encapsulated. It's a very specific site, no toxic side effects, good biocompatibility. So this is kind of so you can visually see how it kind of kills off the blood supply to the tumor. And a common way to test drugs, for that is what's called the chicken Curial allantoic membrane, so CAM, and they use that for several different reasons. Just because it's highly vascularized and it's thin, you can activate or you can access it easily, and you can monitor it easily. So this is what it looks like. So they did a test then with the liposomal ICG. And then after incubation, it was irradiated then with the laser. And so just wanted to kind of see, this is when it's free, no ICG. And so you can kind of see, a little bit of an impact, but not really. It all kind of grew back again. And that's without the ICG. And then with the ICG, so you can see the blood supply. I mean, it completely just kind of shattered the blood supply to that area, which becomes really important. And with the tumor, if you can kind of shut down its angiogenesis, which means a production of blood vessels to feed the tumor, if you can shut that down, then you can kill the cancer. So this is really exciting. As you can see, it's just a big hole right there. So this, again, just for PDT, interstitial PDT with Lipo-ICG for lung cancer. So then you can add then sonodynamic therapy, where you add also sound or ultrasound, and that also creates an impact on the tumor, where it creates these cavitation bubbles to kind of kill the tumor as well. So if you can use that, you kind of pile all of these therapies on to make them more and more effective. So that's what we want to do. So here, just kind of a call to action. Reducing toxicity of cancer therapy and recognizing the needs and taking action. So doctors are starting to recognize, the significant toxicity and symptom burden observed with all forms of cancer therapy. So that is becoming an issue because you're killing the tumor while you're killing the patient at the same time. So you have to kind of, yes, the therapy might be effective in reducing the tumor, but the patient died. So you need to recognize the toxicity and the impact of the standard of care therapies that exist there. So the toxicity of the cancer therapies, chemotherapy contributes only to 2% to 5-year survival in 22 major cancers based on a meta-analysis study. So it just adds 2% survival to these 22 major cancer. And what they found is that tumor cell debris from chemotherapy, it is shown then to stimulate tumor growth. So here you have, yes, you are reducing then the tumor, but then the debris from kind of destroying that tumor stimulates more cancer growth. So that's why we have the issue that, yes, we have the reduction, but now we found a tumor here, or no, we found a tumor here. So all of a sudden, there's individual tumor everywhere. And here, radiation induces transformation of breast cancer cells to breast cancer stem cells. So now we converted just a normal cancer cell to something that becomes a stem cell that can then be reproduced into other cancer cells and can travel around and place themselves wherever they want to place. Chemo radiation damage the tumor microenvironment, promoting resistance to further therapy. So it actually creates, it's harder than to use other therapies, by just doing that alone. So cancer persists. So here you have a cancer stem cell. It breaks away from the tumors to enable metastases. Chemoradiation, refractory tumors, resistance to future treatments, and also then initiates tumors. So cancer stem cells then becomes a really important deal to look and make sure that they are part of the treatment that you're needing to be part of. And then you have most circulating tumor cells, most CTCs, they do not survive, because we have these circulating tumor cells all the time. But let's say a primary tumor, which is about a 1 centimeter cube, which is not that big, that's about 1 billion cancer cells, and that will release about 1 million cancer cells a day into the circulatory system. So just that one little cancer, every day, 1 million cancer cells. So let's say it's only a 0.01% survival, which means that 100 cells a day are traveling around with metastatic potential. They can decide to become dormant or active. So most CTCs do not survive, but some do. So we need to address the some do as well. So this new photodynamic therapy breaks away the barrier of limited penetration of light into the human body, which I mentioned the previous photodynamic therapy. The issue was that the penetration that it didn't have, so it was just mostly used for skin cancer. And it's become, like I said, it's a standard of care for skin cancer where you inject it with a photosensitizer and then you radiate it with light and boom, you kill the cancer. So this is then to be able to have the same effect internally as you would have externally. It opens the door to new creative technological and clinical approaches. It allows the use of the entire spectral phototherapeutic window. So not just one piece of light, but we can get the benefit of all the whole spectrum and the benefits. As you see, each color have different benefits, and we want to make sure that we utilize all those benefits. And you can use them in a very safe and effective, use it then with a very safe and effective photosensitizer. Provides meaningful access to photobiomodulation that you can use in low-level lasers for. Exactly, and you can do a little screening actually. This was what I was talking about, the machine and from Germany, the conference I was at, where you could look at the circulating tumor cells, look at them live as you were, so you could actually measure them live, and then pre-treatment and then post-treatment of photodynamic therapy, there is nothing there. So this technology allows us then to actually be able to measure live as we do what we're doing, which is exciting. So the mechanism of sonophotodynamic therapy kills cancer cells, modulate the innate immune system, modulate adaptive immune system, disrupt tumor angiogenesis, its production of blood cells, and also kills bugs, all the different pathogens. So it does a lot of cool things. And with going back to cancer, a lot of it are connected to things also. You have drivers like parasites and fungus and viruses that can be a component in the acceleration or production of cancer. So to have something that kills the pathogens that might be an underlying factor becomes very important as well. So you want to make sure that's part of the equation as well. So here's that photodynamic infrared spectroscopy, where you kind of measure and see the circulating tumor cells. So you see here it's a tumor cell, photosensitizer, and then destroying it. And here's just kind of where you're measuring it at the same time. You can kind of detect it, and then you're able to kill it. So here is one person that did the photodynamic therapy. So this kind of seeing the progression of it. So you can kind of see that it looks pretty nasty. They did use some chemo along with it as well. So, and sometimes that's what you need to do. So see how it's just kind of melting away. Obviously here she's not candidate for any kind of surgery, because you're not going to be able to get all of that. And then it got it to then an 80% reduction, and then she qualified then for a mastectomy, so which is really exciting. So, and she's currently asymptomatic without any apparent cancer activity. So that's really neat. And here's a study of a friend of mine that did this, stage 4 breast cancer, March 2018. So you can see how new this is. And this was actually even before the new photosensitizer that we now have. So you can see the number of CA 15.3, CA 27.29. It was at over 11,000. So it shows a lot of cancer activity. And now we're looking at CA 27.29 was at 103.4. Here's 97.5. So they're still elevated, but I mean, what a difference. And so these were some of the observations. The metastatic liver nodules, they were at 26. And let me see here. And they went down to 12 and 17 at the maximum. Then after, I guess they did a scan, then a CT scan back in January 2019, so just a few months ago. And they saw no metastatic or cancer activity in the person. So it's really, really exciting things, that's going on with this. And here, the liver enzymes normal, see the cancer markers decreased, C-reactive protein normal. Patient was able to walk without assistance, no pain. So stopped all pain medication, weight stabilized, increased energy, no abdominal distension, and obviously still continues under care and observation. Mechanism photodynamic therapy. So cancer cells are more susceptible to photodynamic therapy-induced cell death than normal cells, which means that we will impact the cancer cells more than normal cells. And then the mutations in cancer cells caused by the expression of oncogenes can lead to increased or decreased susceptibility to photodynamic therapy. However, it is thought that many of the mutations that lead to resistance emerging in cancer cells exposed to radiation or chemotherapy do not lead to cross-resistance to PDT. So even though you're resistant maybe to radiation or chemotherapy, doesn't mean that you're resistant to photodynamic therapy. And here, talking about the oxygen, that the overall mechanism involves molecular, subcellular, and vascular changes which bring about necrosis and apoptosis of the tumor. And it needs to be in the presence of oxygen. So the interaction releases cytotoxic species, these singlet oxygen, the reactive oxygen species. So just kind of pointing that the need for oxygen to exist. And here, just talking about when PDT induces necrosis of tumor and their vasculature, an immune cascade is initiated. So the immune system kicks in, and which allows then the white blood cells, neutrophils, macrophages to come to that area, to the location of the tumor, so the immune system becomes involved, and also to kind of clean up then any kind of dead debris. And this is because the PDT, the photodynamic therapy, concentrates in the area of the tumor. And so that way the immune system activity gets focused and concentrated in that location as well. So it's felt that significant tumor cell death occurs from these activated immune cells. Upon arrival, these macrophages phagocytize damaged cancer cells, which means that it eats up the damaged cancer cells and present protein from these tumors to CD4 helper T lymphocytes, so it's part of the immune system, which activates then the CD8, which is then the kind of passive immune system. So it's almost like here we're breaking the tumor down, and this is what the tumor looks like. These are the proteins. And so now the immune system creates an antibodies against then these tumor cells. So you activate the immune system's ability to then police the body for these cancer cells, which means that you have to activate the immune system, so you create your own vaccine, literally, for the type of tumor that you have. And it's not just at the site of the tumor, but it also in regional and distant lymphatic tissues. So it's throughout the whole body. And it's just a study that they were running. 14 patients, 12 with stage 3, 2 with stage 4, treated just with PDT alone, and then you had 17 that were treated, 15 with stage 3 and 2 with stage 4, received then photodynamic therapy and hyperbaric oxygen therapy, which we do here at the center. The results at 12-month survival rate, 28.6% for just the PDT group, and then 41.2% with the PDT and hyperbaric oxygen. So bringing then hyperbaric oxygen, then that becomes a much more powerful tool. And remember, these are severe cases, stage 3, stage 4. So these are not easy cases to deal with. So most of these would have been, well, dead by then. Yeah, so to have that kind of survival rate is pretty amazing. And here, and the same is another 23 patients treated with PDT alone, 29 received PDT in hyperbaric. The mean survival time for just PD2 was 8.7. So, and these are cases where they really didn't have anything else to be treated. And then this was 13.8. So it's just showing that the combination of the two was much better. Okay, yeah, just a little study. So with hyperbaric oxygen, photodynamic process can generate abundant reactive oxygen species in the hypoxic tumor. And the synergistic effect eventually results in a significant enhanced therapeutic efficacy. So it's good just combining the two. So just going then to the antimicrobial effect, as showing here, antibiotics kills bacteria, does not deal with fungi, parasite, viruses. Photodynamic therapy addresses all of them. It's safe, inexpensive, and you don't need to take pill. It's versatile, and also antibiotics can't get into dead or damaged tissue. This can, and then so you can see it, and also works on the biofilms of the pathogens for people dealing with Lyme, for instance. That we have these bugs that are hidden by biofilms, and the immune system can't get into it, and they're antibiotic resistance. To kill a bacteria that has a biofilm, you need 100 times more antibiotic in order to be able to kill it. So if you have a therapy that can work on the biofilm, then the antibiotic much more effective. So looking at ticks then, so using this therapy, so you have then people dealing with Lyme, which is essentially a tick disease, but it can be caused by any mosquito, horsefly, a flea bite. They can also carry Lyme and co-infections. So you had 27 patients, combination of Lyme, Bartonella, Babesia. They all had Herxheimer's, after doing the photodynamic therapy until the infections were near resolution. So she didn't, 11 of those patients she didn't follow up with, but the 16 that she was able to, they all had significant improvements, 75% or more energy, cognitive, and also their memory, concentration, processing speed, all of that, had improved quite dramatically. So just showing the impact there. But also you can use it for things like, they've seen with human neuroblastoma cells, the amyloid aggregates in those cells. So this becomes very useful in regards to Alzheimer's. And also people dealing with stroke, traumatic brain injury, neurodegenerative disease. So it has a lot of different usages. But we use it for a lot of different things, but our focus here at the clinic, we do a lot of kind of chronic diseases, such as Lyme disease and cancer. So I'm really glad you guys could hang with me today, and I'm really excited that we have that therapy here. And if you have any questions, just let me know. Thanks.